Your dentist tells you to floss. Every single visit, same message. Floss daily. It prevents gum disease. It reduces your risk of heart disease. It is one of the few free 2-minute interventions that genuinely makes a measurable difference to your long-term health. You probably do not floss as much as you should. Almost nobody does. But when you do reach for the floss, you reach for the one with the smooth glide coating, the one that slides between teeth without catching or tearing, the one that feels like it was engineered to make flossing easier, the one your dentist probably handed you as a sample. Here is what a 2019 study from the Silent Spring Institute found when they measured PFAS chemicals in the blood of 178 middle-aged women and asked them about their daily habits. Women who used one specific brand of dental floss, the smooth, gliding kind, had measurably higher levels of a specific PFAS compound in their blood than women who did not use it. Not marginally higher. Detectably, consistently, statistically significantly higher. The chemical that creates the smooth glide coating on that floss is a member of the same chemical family as the coating on your nonstick pan. The same family that, in a prior episode on this channel, we established has no safe level with full regulatory clarity, and that multiple states have now moved to ban from cookware. It was in your floss the whole time, and your dentist did not know to tell you. The study was led by researcher Katie Boranow at the Silent Spring Institute in Newton, Massachusetts. It was published in the Journal of Exposure Science and Environmental Epidemiology. It was, as Boranow herself described it at the time, the first study to demonstrate that using dental floss containing PFAS could actually increase the body burden of these chemicals in humans. Not the first study to find PFAS in floss. The first study to show it gets into your blood when you use it. The specific product was Oral-B Glide. The smooth coating that gives Glide its name, its entire value proposition as a product, is polytetrafluoroethylene, PTFE, the same compound we covered when discussing nonstick cookware, the same fluoropolymer family that is currently being phased out of cookware in multiple U.S. states precisely because of concerns about systemic exposure. The researchers tested 18 dental floss products in addition to the blood study. All 3 varieties of Oral-B Glide they tested showed evidence of fluorine, the chemical marker of PFAS. 2 store-brand flosses labeled compared to Oral-B Glide also tested positive. One product describing itself as a single-strand Teflon fiber tested positive. The PTFE was not hidden. In some cases, it was the selling point. I want to explain why the mouth specifically matters in a way that is different from most of the other products we have covered. Your gum tissue is not like your skin. Your skin is a relatively effective barrier against many substances. Your gum tissue, particularly when it is inflamed, irritated, or has any microabrasions from flossing itself, is substantially more permeable. It is one of the most blood vessel-rich tissues in the body with direct circulatory access to the bloodstream. When you run a PTFE-coated floss between your teeth, you are running a surface coated in a fluoropolymer directly across this tissue, twice a day, 365 days a year. The 2019 study found the biological signal in blood, not just a theoretical exposure mechanism. The PFAS appeared in the bloodstream of women who used the product compared to those who did not. This is categorically different from PFAS leaching from cookware into food that then passes through a full digestive system. This is a direct oral exposure route, in contact with highly vascular tissue, repeated twice daily for years. Oral-B, when the study was published, said that none of the substances in the report are used in their dental floss and that consumer safety is their top priority. The study's methodology is worth understanding briefly. The researchers did not test for specific PFAS compounds directly. There are over 10,000 known PFAS compounds, and testing for all of them is not feasible. They tested for organic fluorine, a chemical marker that all PFAS share. Elevated organic fluorine indicates the presence of fluorinated chemistry. Oral-B's position was that whatever compound was creating the fluorine signal was not a PFAS of concern. The study's position was that PTFE, known to be used in Glide's formulation, is a PFAS polymer, and that blood levels of PFHXS were elevated in users of that specific product. What happened next tells you something important about how this story ends. The broader testing picture that emerged in the years following the Silent Spring study is what elevates this from a single brand story to a category concern. Mamavation, in partnership with Environmental Health News, tested 39 dental floss products at an EPA-certified laboratory, screening for organic fluorine as an indicator of PFAS presence. 13 of the 39 products showed evidence of PFAS. That is approximately 1 in 3. Levels ranged from 11 parts per million to 248,900 parts per million. That upper figure, nearly 25% organic fluorine by weight, came from Oral-B Glide, which recorded the highest level Mamavation had ever found in a consumer product across all of its testing programs. 4 products in the Mamavation testing showed PFAS levels above 70,000 parts per million. These were not trace contamination. The researchers concluded that in cases with very high fluorine levels, the PFAS was almost certainly added intentionally as a functional coating rather than being an incidental contaminant. At the same time, many products in both the Silent Spring and Mamavation testing showed no PFAS at all. Waxed flosses using natural coatings, beeswax, carnauba wax, candelilla wax, consistently came back clean. Unwaxed nylon flosses consistently came back clean. The PTFE was not present across the entire category. It was concentrated in the products that marketed Smooth Glide as their distinguishing feature, and it was absent in products that used alternatives. This matters because it is precisely the pattern we saw with food dyes and with avocado oil. The chemicals were present because of a specific functional choice, not because they were unavoidable. Alternatives existed and worked. Here is the update that almost no coverage of this topic includes, and it changes the entire ending of this story. Oral-B eventually reformulated Glide. The updated product now uses what the company describes as a micro-textured fiber rather than a PTFE coating. Silent Spring Institute, which conducted the original blood study, subsequently confirmed that the reformulated Glide does not show the same PFAS indicators as the original product. The science worked. One of the most widely used dental flosses in the United States changed its formulation in direct response to research that demonstrated the original formulation increased PFAS blood levels in human subjects. But here is what the update does not resolve. The reformulation was Oral-B's voluntary decision. It was not required by any regulatory body. There is no federal standard requiring dental floss to be tested for PFAS before reaching consumers. There is no labeling requirement that would allow you to know at the point of purchase whether the floss in a given box contains fluoropolymer coating. Minnesota, as of 2025, has become the first state to specifically ban PFAS in dental floss as part of its phased PFAS restriction schedule. Other states have not followed yet, which means that in most of the United States, the protection available to you is exactly what has been available throughout this entire series: your own label literacy. Here is the full picture. A study demonstrated that using a specific dental floss product increased PFAS blood levels in human subjects. That product was identified as containing PTFE, a fluoropolymer. The manufacturer contested the finding. Multiple subsequent independent tests confirmed PFAS indicators in that product, and in approximately 1/3 of all floss products tested. The manufacturer eventually reformulated voluntarily. No regulatory body required it. In the meantime, no mandatory testing existed. No labeling requirement was created. No national standard was established. The vast majority of the market continues to operate without any PFAS disclosure requirement. Your dentist was telling you to floss correctly because flossing prevents gum disease and is associated with cardiovascular benefit. Your dentist was not telling you which floss to use because your dentist does not have PFAS testing data on dental floss products. Nobody gave them that data. The ADA seal of acceptance on a floss package does not indicate PFAS testing has been conducted. It indicates a review of clinical efficacy for the stated dental hygiene purpose. You are flossing correctly. The habit is right. The product choice is what nobody told you to look at. The practical change here is the simplest this channel has ever offered. Simpler than the bread label check, simpler than the avocado oil color test, simpler than the microwave container swap. Stop using floss that says PTFE on the label, or that markets itself with Glide, Smooth, or Slide as its primary descriptor. These are the linguistic signals for the fluoropolymer coating that the science connects to elevated blood levels. Switch to one of the following: unwaxed nylon floss, floss coated in beeswax, carnauba wax, or candelilla wax, or floss explicitly marketed as PFAS free with independent testing documentation. All three categories performed cleanly in both the Silent Spring and Mamavation testing. All three are widely available. None are specialty products requiring a health food store. Several major brands are available at standard grocery chains and pharmacies. If you want a specific starting point, products without any coating at all, plain unwaxed nylon floss, remove the coating question entirely. They are the lowest friction choice in terms of the chemical decision, if not always the smoothest flossing experience. One more note on the dentist. If your dental office hands you a sample of floss with a glide coating, you can use it once and then replace it at home with one of the alternatives above. The sample is not the habit is what matters. Here is something worth sitting with, because it connects this episode to everything we have covered in this series. Every product category we have examined has followed the same structural pattern. A chemical is present for a functional reason. It is not tested for safety in the way a drug would be. Evidence of harm accumulates in independent research. A regulatory gap means that evidence does not automatically require mandatory action. The consumer continues to be exposed. In some cases, the market eventually moved when the reputational cost of inaction exceeded the cost of reformulation. Oral-B Glide is one example. Food dyes are another. In other cases, potassium bromate in bread, voluntary phase-out was requested and not completed, and state legislation is now doing the work federal regulation has not. This is not a conspiracy. It is a structural feature of how consumer product safety works in the United States, an opt-out system where the default is permitted unless harm is demonstrated. Knowing this means you are never just waiting for the next headline. You are asking the same question every time. What is the functional ingredient that creates this product's distinctive quality? Was it tested for systemic safety, and is there an alternative? Your dentist is still right. Floss every day. The oral hygiene benefit is real, the cardiovascular association is real, and 2 minutes of flossing remains one of the most cost-effective health habits available to you. The only thing that changed is which floss you reach for, not the smooth, gliding kind, the waxed kind, or the unwaxed kind, or the one whose label says nothing about Teflon or PTFE or slide or glide. The one that does the same job without the coating that ended up in the bloodstream of the women in a 2019 research study before anyone in the regulatory system required the manufacturer to change it. Your dentist gave you the right habit. This channel gave you the right product. If you want the next product examined with this same level of care, subscribing is how you get it. I will see you in the next video.